Hi guys. Today let's talk about one of my other favorite topics. So you'll hear me say over and over and over again, what's the biggest factor in the aging process and how we look aging wise? And it's always skin. And if you're like me, that makes you cringe and cry inside because to me, skin is a big undertaking. And I was always of the opinion before getting into this field, I was, a tanning bed queen. Homecoming prom, I'm sticking my Playboy bunny on. I am going every day, 20 minutes. And why, I don't know. My daughter always is like, why did you think that was a good look? It was a trend. Okay, it was cool to be orange. I don't make the rules, I just followed them. So I had a lot of damage to undo. So when people would talk about the aging process and how good skin was what made you look young, I basically wrote it off. I was like, well, it's too late for me. Chalk it up as a loss. And that's not the case. And it is so, so true. So when I have my patients come in, they're always talking about fine lines and wrinkles. Yes, absolutely, number one. And there are different modalities we can use for that. The big guns, I like to say the Botox, the filler, things like that. Yes, the biostimulators, Sculptra, Juvederm, Restylane, Dysport, Botox, things you've all heard of. But there's other things that we can do too, and they all work together. So if you're like me and you want that instantaneous gratification, I want to know that this is working, I want to see it working, then you usually want to combine a few different treatments to get to where you need to go. Another thing I hear a lot of women say, and they maybe don't even know what's causing it, is I have a lot of spots here, or I have a lot of redness here, or I have these little vessels here. And I like to sit them down and we have a frank conversation, not only like, were you a tanner? Do you have a boat? Are you out on the water a lot? Here in Iowa, in the Midwest, I tell people all the time, it hits 60 degrees and we are gone. We are in shorts, we are on the water, we only get a few months. Okay, this is not California. We cherish our sun time. And so if we're on the water with that light reflection, without sunscreen, we're not reapplying. We've been doing that for 20 years. And then you come to me and you say, Liz, I have all these spots. Well, yeah, a lot of that's probably sun damage. So we need to have an honest conversation, not only about what we can do for your fine lines, your wrinkles from that, your volume loss from that, but what do we do about these pigmentation issues? And then we have a conversation where we lay out a few different modalities for you, a few different treatment options. And whether that's a laser treatment, a series of laser treatments, whether that's a chemical peel, whether that's some microneedling treatments, those are all different options. But we need to also talk about, are you going to be able to be out of the sun for a week or 2 weeks? Are you going to be able to be red and have flaky, peely skin for a few days or a week? If you're getting a chemical peel, with some microneedling, you might be red for a few days. With a laser treatment, you need to be out of the sun afterwards and before. Are you going to be able to be off self-tanner? Because all of those things contribute to that treatment plan. So those are all options for pigmentation issues. Those are all options for fine lines, wrinkles, and texture. And I think we're really good at letting people know Botox is for wrinkles. Filler can be for wrinkles, but filler can be for bigger lips, if you've lost some cheek. But we aren't really good at letting people know how those other modalities work. So, chemical peels, they're taking off those damaged layers and they're getting that skin to shed and those new, nice, undamaged cells to show. And that's great. It works well for acne. It works well for acne scarring. Same with microneedling. What is microneedling going to do for me? Well, microneedling is making little tiny channels into that layer of the skin, the dermal layer of the skin, which is really kind of hard to reach. You think about the skin and you have your epidermis, so your uppermost layer, you have your subcutaneous fat. We all know where that is. That's, towards the bottom. But that dermal layer, it's important for cell regeneration. It's important for healing, and it's hard to get to. So microneedling can really help with, yet again, acne scarring, some pigmentation issues, and just producing more collagen. Okay, so when I think of what does collagen do, I think of my 14-year-old and my 3-year-old even. Why do they have this really firm, supple, young-looking skin? We talk about baby smooth skin, baby skin. Well, it's because they're still producing quite a bit more collagen and elastin than I am at 34. So anything that I can do to increase my collagen production and some of that elastin production is going to ultimately help my overall aesthetic appearance. So when my skin has a lot of elastin, obviously it's elastic, literally. So when I'm pulling on things, they're bouncing right back. They're nice and tight. When we age, we all know things just don't bounce back the way they used to. Things start to get saggy. So that's part of the problem there. And then the underall problem of collagen production. So you hear the buzzword, collagen is all the rage right now. We're drinking it, we're taking supplements, and yes, that all helps. But to get the real visible appearance of more collagen, you probably need to do some medical grade treatments, whether that's a microneedling. We have the biostimulator Sculptra that we inject, and that wakes some of your cells that produce these things back up, and that fills in things very naturally. It gives what we call a glow, a Sculptra glow to the skin, because it's producing so much more of those factors. So your complexion is glowing and it's filling in the way it did when 10, 20 years ago, because it's waking all those factors back up that have been kind of sleepy. They tried to retire and we said, no, thank you, please come back. And the same with laser. Laser is a wonderful tool. There's a lot of prep work, a lot of education, a lot of knowledge that needs to go into each of these treatments. Laser is no different. Laser can get rid of a lot of that pigmentation. A lot of, laser hair is a huge thing for people where I'm at. So it actually can zap that hair follicle and really get some of those factors going to get rid of some of that hair production. It can get rid of vessels in some instances, depending on what vessels they are. If they're little vessels that are just little broken capillaries, little tiny baby blood vessels around the nose or on the skin, or are they big, huge spider veins? We have to have a discussion about that too. So all of these things can be done, but we need to have a discussion about them. And we need to let you know, we need to be very clear in our discussion what the pre-work looks like before we get this treatment and what the post-care instructions are. And please don't ever go anywhere and just sign up for a treatment. Don't go online and book something if you aren't sure you know what goes into the treatment leading up to it and what you need to do to get that best outcome afterwards. Those are very, very important things. But definitely have a conversation, develop a treatment plan. You don't have to know any of this. You come in and you say, this is what's bothering me, or this is my history. But you have to be very clear with your history too, with your provider, if you want to get that best outcome. It breaks my heart when people come in and they don't tell me things because they think I'm going to judge them. We are in no position to judge. We are never here to judge you. We want to help you. So all of that history needs to be gathered so we can discuss as a team, you, I, my esthetician, my nurse. We need to all discuss this together and come up with what works for you. All right? Thanks, guys.